We tend to treat earwax like a hygiene failure, but this viscous, golden liquid is a dedicated defense mechanism. It lubricates the canal, fights off bacteria, and physically traps invading dust and dirt. Under normal conditions, your ear cleans itself. The wax naturally migrates outward, dries up, and falls away without you ever noticing. The problem starts when that migration process breaks down. Whether your body overproduces wax or you accidentally interfere with it, the material builds up and creates a physical blockade. This diagram compares healthy wax to a blockade. A true impaction triggers distinct symptoms: fullness, muffled hearing, tinnitus, and pain. But beware, these exact warning signs overlap perfectly with serious middle ear infections or damaged eardrums, making self-diagnosis highly risky. This leaves you in a tough spot. You want immediate relief from that maddening muffled feeling, but reaching for the wrong tool can cause permanent damage to your delicate hearing anatomy. To safely clear a blockage, we evaluate removal methods based on a strict trade-off: how much convenience you gain versus the physical risk and actual effectiveness of the technique. Let's start with this comparison matrix, looking first at manual extraction. This category includes sticking objects like cotton swabs, hairpins, or lit hollow candles directly into the ear canal. The appeal is the immediate speed, but the safety and efficacy are alarmingly low. Take cotton swabs. They might pull out a tiny bit of surface residue, but the blunt tip acts like a plunger. It rams the vast majority of the wax deeper into the narrow canal and packs it tightly against your eardrum, increasing your risk of a severe impaction or a ruptured membrane. Then there is ear candling. The theory is that lighting a hollow cone placed in the ear creates a localized vacuum, which supposedly sucks the wax upward and out. Physics does not support this. The burning cone generates zero extraction force. The brown material you see inside the cone afterward is simply melted wax from the candle itself, not debris from your ear. Worse, candling introduces the very real hazard of catching fire or dropping hot melted paraffin directly onto your eardrum. Manual extraction methods offer the psychological satisfaction of feeling like you are cleaning yourself, but they buy that feeling at the cost of packing the blockage tighter or causing permanent injury. They belong in the trash. Our second row is softening agents, which includes medical-grade olive oil and over-the-counter carbamide peroxide drops. This method flips the trade-off completely. It is highly safe, but it is incredibly slow. You have to follow a strict, repetitive regimen. You apply the drops 2 to 3 times a day, and you may need to keep that up for 2 full weeks. The drops work by chemically breaking down, dissolving, and softening the hardened blockage. Instead of yanking the wax out, the liquid restores the ear's natural self-cleaning process so it can push the material out on its own. While you wait, you have to endure the physical discomfort of the process. Your ear will feel wet, and the softening wax will temporarily muffle your hearing even further. Softening agents do have limits. They frequently fail against severe, rock-hard impactions. And if you have a ruptured eardrum, putting any liquid in your ear is strictly unsafe. Over-the-counter drops are the cheapest and safest DIY method available. You simply have to pay for that safety with immense patience and a few weeks of annoying discomfort. Our third category is home irrigation. This involves actively flushing the ear canal with water to wash the blockage out. Historically, clinics used large, heavy metal syringes with narrow nozzles to blast the wax out. Medical guidelines now consider this rigid, high-pressure approach outdated due to the high risk of damaging the eardrum. Today, the home protocol looks different, as reflected in our matrix. First, you must pre-soften the wax with oil for 3 to 5 days. Then, you use a specialized quad-tip syringe. These tips direct 4 separate streams of water against the canal walls, rather than firing a single jet straight at your eardrum. If you try this, there is one absolute rule. The water must be exactly room temperature. If the water is too hot or too cold, it triggers the caloric effect. This physiological reaction throws off your inner ear, causing sudden, severe vertigo and dizziness that can drop you to the floor. You also have to manage the pressure. Pushing the plunger too hard can easily perforate your eardrum or force water behind the wax plug, creating a trap for bacteria that leads to swimmer's ear. Home irrigation is affordable and yields faster results than drops alone. But to avoid serious medical complications, you must execute the temperature and pressure protocols flawlessly. This brings us to our final category, professional intervention. Historically, safe extraction meant a doctor using a specialized illuminated optical tool to look directly inside the canal, manually navigating the delicate anatomy. Today, the clinical standard is microsuction, shown here in our final matrix row. An audiologist or ENT uses a high-powered microscope and a tiny, precise vacuum to carefully lift the wax away from the skin. This method resolves the blockage in minutes. It requires no water, introduces no chemicals, and physically prevents any material from being pushed deeper into the ear. The trade-off here is logistical. Microsuction requires the highest investment of money to cover specialist fees or copays, plus the time and effort to schedule an appointment and travel to a clinic. However, for certain people, specifically young children or adults with a history of ear surgeries, this is the only medically recommended option. DIY methods are too risky for these groups. Professional intervention demands the most upfront cash and scheduling effort, but it remains the gold standard because it guarantees immediate, visually verified results with effectively zero physical risk. Let's use this decision flowchart to map out exactly which path you should take right now. Start with the red flags. If you have active pain, fluid discharge, or a history of ruptured eardrums, skip all DIY methods immediately. You need to see a doctor. For standard blockages without red flags, the deciding factor is time. Are you willing to endure muffled hearing for 1 to 2 weeks while a treatment works? If you are prioritizing your budget, commit fully to the 14-day drop routine. If you decide to escalate to a home syringe kit, you must obey the room temperature water rule to protect your inner ear. If you are a parent or caretaker, stick to over-the-counter drops or wiping the outer ear. Never use a syringe or flush a child's ear at home. For those of you looking for a quick fix in your bathroom cabinet, throw out the cotton swabs and the hollow candles. The fast relief they seem to offer is a dangerous illusion that usually ends with a medical bill. If your blockage is severe and impacting your daily life, skip the pharmacy aisle. The return on investment for professional microsuction is truly unbeatable when it comes to safely restoring your hearing. Ear health requires respecting the body's natural anatomy. When you decide to intervene, you have to choose intentionally whether you are spending your time, spending your money, or gambling with your hearing.